Are you new to learning about oral weight medications? Well, this video is a great, simple, straightforward primer. Are you confused about your weight? Do you have questions about weight medications? Do you want medically based answers to your weight questions? If so, you are in the right place. I'm Dr. Meghan. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is important because I'm a medical doctor. I regularly prescribe these medications. I actually talk to patients about their weight, and I've helped hundreds of patients lose weight, and I'm here to help you too. So welcome. I'm making a new patient series. We're doing a deep dive into all the general categories that I regularly talk to patients about when we're thinking about starting a weight medication for them. So this is going to be an overview on the oral weight loss medications. The oldest medications for chronic weight management were stimulant medications. And the first was really phentermine. So that was approved in the 1950s. And the approval for that is sort of kind of a historical hiccup because it was initially approved for just 3 months use, but really we use it now as an ongoing medication. We've been using it for decades, and I made a whole video about phentermine in particular, so I'll link that down below. But the bottom line is we use it lifelong like we would for any other chronic weight medication. There are a couple other stimulants that are available, but they're really more of a historical classifications, or maybe, if that's the only one that can be, only class that can be used, and people are having access issues, their doctor might try one of these, but they're definitely not kind of generally prescribed. So if you've heard of something like diethyl-propion, phendimetrazine, or bensphetamine, those are all kind of in that more historical stimulant category, really aren't prescribed much today at all. If you are getting a prescription for those, you definitely want to talk to, an obesity medicine physician who does this a lot, so they have experience with those. Also, there are two important combination medications. So there is Qsymia, which is a combination of phentermine and topiramate. Again, I've made individual videos about each of those, so you can definitely go check those out. But this is helpful to know. They work synergistically, so you get a better effect from them together. And so the brand name is Qsymia, but if your insurance doesn't approve it, usually patients can talk to their doctor, and because they're both available as generic, there are ways to co-prescribe them so you're getting essentially a very similar effect. And for these, patients can anticipate losing between 5 to 7%, maybe 10% total body weight loss on a good day. Phentermine, again, is a stimulant medication, and topiramate is an anti-seizure medication, but we use it off-label for many different things. Now, the second medication that is a combination medication for chronic weight loss is Contrave, which is a combination of bupropion, which is an antidepressant, and naltrexone, which is an opioid antagonist. So it's the same medication that's in Narcan to reverse an opioid overdose, but it's also available as an oral medication. And so when they're prescribed together, again, there is a synergistic effect, and patients can expect to lose about 5 to 7%, maybe 10% again on a good day, total body weight loss. And again, like Qsymia, like phentermine, topiramate, let's say someone's insurance won't cover the brand name, you can talk to your physician. There are ways to co-prescribe them so that you're getting a very similar effect from the generic medications. What's nice about these combination medications is you can often get like a 2-for-1 effect for a patient, because let's say somebody has obesity, but also they have migraines, or let's say somebody has obesity, but also they have depression. Well, for that first patient with the migraines, the phentermine topiramate might be a really good fit for them because you're treating their weight and it might help out their headaches. And for the second person, you're treating their overweight or obesity, but also may really help their mood as well. So a lot of these you can get like a 2-for-1 impact for the right patient. Also, metformin, which is a diabetes medication, can be used off-label to help with chronic weight management. That's not a great effect that you're getting from that one. It's usually about 3%, but sometimes it can be a helpful addition for patients depending on what their other medical issues are. And also you can use topiramate on its own as well to help with chronic weight management. Again, I made a whole other video about topiramate, so I'll link all those separate videos down below. Thank you so much for watching. If this video is helpful, like and subscribe, do all the things. If you want to work with me directly, I'll leave my website information down below, and please be well.